I would first like to thank you for your support to set up the subcommittee on measures relating to the development of Chinese medicine. We have a quorum. I call to order a meeting of the subcommittee. Let's go into the first item, election of deputy chairman. The Secretariat has issued a notice before the meeting to notify members that at the end of nomination period for the office of deputy chairman, only one valid nomination has been received. The nominee is Mr. Kingsley Wong. The one who made the nomination was myself, and it was seconded by Mr. Chan Hock Feng. According to paragraph 80 of Appendix 4 of the House Rules, if any valid nomination has been received for the office of deputy chairman of a subcommittee, the members may decide whether there is a need to elect a deputy chairman. All right, I declare Mr. Kingsley Wong the nominee duly elected as the deputy chairman of the subcommittee. Let's go into the second item, schedule of meetings and items for discussion. First of all, for items for discussion, I would now invite members to propose items for discussion. Members may refer to the terms of reference and work plan. This is Annex 2 of the document tabled before members. I will also ask members to press the request to speak button now. I'll assign a 2-minute time limit. Thank you. The first to speak is Mr. Chan Cho-kwang. Thank you, Chair. Actually, it's the first time that I'm speaking as the first member to speak. Now, last week we visited the Chinese Medicine Hospital of Hong Kong. I think there is a great bottleneck with the development of Chinese medicine. There is no way for us to refer patients to do diagnostic tests such as X-ray, blood tests, MRI. Is it the case that in law we can empower Chinese medicine practitioners of such? Western medicine practitioners also make judgments based on their experience, just like CMPs. With Western medicine, with diagnostic capabilities, it has greatly enhanced their treatment capabilities. CMPs are restricted in this way, and I think this is unfair. As medical practitioners, Chinese medicine practitioners are also making a diagnosis based on symptoms. With diagnostic tests, they can have even more accurate judgment. I think we should seek the same treatment for CMPs. Thank you. Thank you, Mr. Chan. Mr. Alex Fan. Thank you, Chair. As a CPPCC member, I have made several proposals before regarding Chinese medicine. I would urge the administration to hold more leading forums or global seminars in Hong Kong. Chinese medicine is a national treasure, and we have many countries having learned Chinese medicine would say this is their own skill. Say in online we have people saying they have Western acupuncture, but it's actually a treasure of the country. It has always been Chinese acupuncture. They may have just done something else with it. It's stealing, essentially. So if we can hold more exhibitions and forums to really consolidate our foundations as the Chinese medicine origin. Thank you, Mr. Dennis Leung. I note in the work plan there are 5 major directions. I have some suggestions we can add to the work plan. We have healthcare vouchers being available for Western medicine services. In future, can we make use of such vouchers for Chinese medicine services? And can we have CMPs covered by the e-health system so that we can have sharing of medical records between Chinese medicine and Western medicine. Next, on the development of Chinese medicine, we have many counterfeit drugs. And there is a prevalence of such counterfeit drugs. Can there be more regulation so that we have only authentic drugs sold and bought? Next, we do have plans to impose limits on pesticides in Chinese medication. How are we on the progress of setting up of standards and implementation? Next, on publicity, we want to promote Chinese medicine culture. We already have some activities in primary and secondary schools. How can we enhance such publicity to foster a universal culture so that we will have more people studying Chinese medicine and enhance relevant services? Chinese medicine is also an intangible cultural heritage. How can we enhance development in this area? Fifth direction in the work plan is about us going global. How can we promulgate standards in Chinese medicine so that we can rediscover our label as a Chinese medicine hub that we had so many years ago? Thank you. Professor Alex Fan. We have quite a few points under the work plan. We have broad coverage, but I also think we should have some targeted discussions. Under point E of the work plan, we have the cooperation and development of Chinese medicine and other medical disciplines. Mr. Chan Chu-kwang said specifically there are issues with referrals. And with the amendments made to the Allied Health Ordinance, we already have some foundations for CMPs to make referrals. But from recent feedback from the trade, I understand that we have some bottlenecks that tie in with the guidelines, say for tests and diagnostics. We have preliminary guidelines, but under the CMP board, we still have not specific guidelines for occupational therapists and physiotherapists, but we already have the legal foundations. I think we can go through the Chinese Medicine Council to make sure we have guidelines that rely on the laws to give more room for CMPs to provide services to patients, and this should in turn benefit the whole society. Thank you. Thank you, Professor Fan. Dr. Thomas So. Thank you. I only have a suggestion. With the 5 points under work plan, I think they are very comprehensive. I just have a suggestion to see if we can include it under points 3, 4, and 5. It is about making use of technology to promote the upgrading of the sector. Right now, we still don't have under the Chinese medicine development blueprint how to digitalize and transform the trade. And the trade is a professional one. I can see, for example, e-health is now available for CMPs participation, but we only have 1,000 odd CMPs who have registered. So I think if possible, the subcommittee can discuss how we can make use of innovative technology to promote innovation within the Chinese medicine sector, how we can enhance service efficiency, how we can develop more business opportunities, and how we can digitalize consultations in Chinese medicine. Thank you. Miss Michelle Tang, thank you. Chinese medicine is has an advantage in tackling chronic diseases. My husband is a Western medical practitioner, but my family actually supports greatly the development of Chinese medicine. There are many different issues involved in the discussions relating to Chinese medicine, tests, in the development of the sector, and development of the occupation. We have many traditional CMPs, but we also have many more recent graduates. Will we have in employment policy priority given to local graduates so as to provide an incentive for youngsters to study Chinese medicine? We also have some other professions associated with Chinese medicine, such as dispensers and other occupations. I think we can also discuss how we can nurture talents for the sector. With CMPs, they do not necessarily have to practice. We can also develop other areas such as clinical research. And that comes to the issue of having professional certifications for Chinese medicine. We need to make sure the Chinese medicine clinical and training institute can become really an edge of Hong Kong. So I hope that we can really discuss the nurturing of various talents. Thank you. Dr. Chen Han Pan. I think the work plan is very comprehensive, covering different areas. I have two concerns in particular, however, about constructing Chinese medicine hub developments in the northern metropolis is very important in order to help Chinese medicine go global. Will we be able to explore or research into perhaps some restrictions that we may have to relax? Next, on CMPR, how can we promote Chinese medicine development with the center? With the CMPR having been established and with the relevant laws promulgated, how can we follow up on this? I think we should discuss this in future. Thank you. Ms. Jenny Mann. Thank you, Chair. I very much agree with what is stated in the terms of reference and the work plan. I have two concerns, however. We want to have a hierarchy structure for the Chinese medicine profession. We need to nurture talents to develop Chinese medicine. And Chinese medicine takes much time to study, just like Western medicine. But there is much room for improvement with the pay. So I think we can discuss how we can attract more talents to develop the profession. Right now with the Chinese medicine hospital, we have different disciplines available with nighttime in patient services as well as outpatient services. I think we can discuss the various services to make sure there is long-term development of the Chinese medicine profession. Ms. Chen Ho-Yen, thank you, Chair. Chinese medicine is not unique to Hong Kong. I believe the Chair is well aware, as you have visited many clinics and hospitals in the mainland. Many members are quite familiar with the situation, and we should not waste much more time because we already spent much time on CMP registration and regulation. We are not starting at the starting point. We are seriously lagging behind. We need to really move forward. I think we can refer to the experience of the mainland and start there. And with Chinese medicine development, as mentioned in the policy address, we should start early with the promotions. We should incorporate elements of Chinese medicine in schools' curricula. For example, how to distinguish Chinese medicine, knowing the Chinese herbs, and how we can incorporate Chinese medicine in people's diets. It may involve other policy bureaus with such discussions. We should also make sure there is a reference with the pay that would tie CMPs with Western medical practitioners. We should not only discuss issues, we should move beyond that with our work with the administration to make sure we have a concrete timetable by the end of the completion of work for a subcommittee. Thank you, Ms. Chen Hoyan. Next, we have Dr. Simon Lee.
Well, the scope drafted in the paper is very comprehensive. Last week, headed by Dr. Ko Wing-man and I as a deputy chairman, we conducted a ceremony to mark the opening of a CM Chinese medicine platform under an NGO. I would like to refer to paragraph 2B and paragraph 2E, and that is for 2B, local and overseas market for Chinese medicine, and also the testing and verification of Chinese medicine. I hope we would go further and explore the possibility of a market, an exchange of Chinese medicine materials. Hong Kong is in a very advantageous position to do this. So I hope this can be done through the expansion in the legal provisions. Now we have new technology such as AI and smart medicine and healthcare services. But this would help CM, such as tracing of Chinese medicine and the sources of production. So this could be looked into. And we should also revise the definition of proprietary Chinese medicine. This is an important market for Chinese medicine. Perhaps the subcommittee can also look into this. Thank you. Next, we have Mr. Siu Gao-fai. Thank you, Chairman. Chairman and some other members have said that the proposed scope of work is very comprehensive. We should try to go global. We should go to the outside to develop the potential for CM. And also in relation to B, on use of test checks and tests and verification, I would like to see what kind of available information is there to facilitate the development of common standards which are acceptable to other places, so that Chinese medicine can enter the world market. Next, we have Dr. David Lam. Well, the draft framework is very good. Perhaps we should consider the promotion in the whole country, Hong Kong's unique practice of having a purely Chinese medicine style in healthcare. Or perhaps we can also go outside and promote this internationally, so that we can improve the branding of Chinese medicine. If we want to look for clinical data. They are not found in the universities, but in the Chinese medicine practitioners and clinics in the community. Perhaps we can conduct some research, coordinating the 18 districts and the CM clinics as well as the CM hospitals, so that we can foster the establishment of a research platform. Okay, thank you, members. Thank you for your valuable input. And I would just like to add one point here. We all know that in Hong Kong, there's no statutory registration system for CM practitioners. To facilitate the further development of CM, I hope there will be we should explore, or we should have some discussion to explore the possibility of a professional registration system for CM practitioners. If members have no further points to make now, we would be convening working meetings to consider the points and suggestions made by members. In due course, the Secretariat will inform you of the dates of future meetings. Now, any matter under AOB from members? If not, then meetings adjourned. Thank you.